Hi, my name is Megan Grace, and I'm currently a first-year graduate student at the Post-Professional Athletic Training Program at the University of South Carolina, and today I'm going to be showing you how to make a makeshift tourniquet. Supplies you are going to need include a piece of cloth. I've chosen leggings for this example, and something to represent the windlass so that you can wind it up, and I'm going to use a pair of scissors. So what you're trying to do with the tourniquet is cut off the distal blood supply on an appendage where you may have a really deep cut you couldn't stop the bleeding with by packing with gauze or holding pressure. And what you're doing is you're applying pressure to a proximal artery in order to stop the blood flow back down to that kind of wound where you have it, and I'm going to show you how to do that. So for the sake of this video, we're going to pretend I have a really deep cut right here. It's packed with gauze and it won't stop bleeding. So we're going to make a tourniquet. So we're going to take that cloth, whatever you have, like I said, I'm using those leggings, and we're going to tie it at the topmost part of your thigh, as far up as you can kind of get up on there. You're going to tie a little knot and you're going to pull it as tight as you can. So nice and tight there. Now that's not going to stop the blood flow, so we're going to take our windlass. I'm using scissors, place it on the middle of that knot, and tie another knot around those scissors. Then, once you have that knot tied around the scissors, you're going to turn the scissors to start to cut off that blood supply. So once you feel like you've cut that blood supply off, or it feels really tight and you can't turn it anymore, and that blood doesn't seem to be flowing in the wound anymore, you're going to tie those scissors, or the windlass in this case, in place. And I like to wrap the legging around one side, bring it around the other side, bring it back to that first side, pull it around, and then tuck it under. And then you want to check and see what time it is so you know what time you started it. For us, that's going to be 4:22. That's information you'll pass on to the next healthcare professional when you pass this patient off. And that's how you apply a makeshift tourniquet.